Meanwhile, the Health Minister says government needs all the support and cooperation as it prepares to vaccinate the elderly come Monday. He says those who have registered will start getting messages this weekend on more information about the vaccination process. And Kize was speaking on Morning Live earlier.
I expect that some of the messages will come later this weekend. But not at this point, we have not sent any of the messages. So what sometimes people might confuse is when we're sending messages out to say the vaccines are coming, get ready, and so on. But that doesn't mean you must stand up from that point and then go to the vaccination sites. We are going to be announcing those vaccination sites. We're just going through the distribution. And even there in the vaccination sites, those vaccinators are all trying to make sure that everything is ready when they come. So, as I've said, it's going to take a bit of a while. We do expect there will be some hitches as we start, but we will get it right. At the end of it, this is the one thing which you are not going to get right from a plan on a piece of paper. This is something that's going to get right when you begin to see how things are unfolding on the ground. So we will need support and cooperation as we move along.
The Gauteng Health Department says healthcare workers who have not been vaccinated by the end of the Sisonke program this week will be accommodated in the second phase of the rollout. The department has called for calm as vaccination centres in the province experience long queues. Now, for more on this, let's cross live to our reporter, Maageketla Mohlabe. He's at the Netcare Milpark Hospital in Parktown. Maageketla, a very good morning to you. Let's talk about what we seeing at the moment. I mean, the live visuals are just cars and cars and cars queuing outside Milpark. Talk to us. What's going on?
Leanne, I can tell you that it took us about 30 minutes to get to the point of where we are right now. We're just a few meters away from the Netcare Milpark Hospital main entrance. But as you can see, many cars trying to navigate their way into the hospital, obviously these are health workers, trying to make sure that they are getting into those queues inside the hospital. I mean, either way, if I may ask my colleague, Gabin Jogwene, to show you that's the side that we actually came from. Starting from the robot, about 200 kilometers down that bridge there. That's where the traffic starts to be jammed. This side, on my camera person's colleague's back, I don't know if he might be able to turn that side. There is a sun. You will actually excuse us. The sun might just disturb us a bit. There is a long queue as well of cars, vehicles trying to navigate their way into the hospital. Either way, it's jam-packed. If you are going to turn to your right down there, that is bears no deer. There as well, there are some cars trying to come this side. It's jam-packed. So this obviously tells you a story about this rush. Healthcare workers trying to get their chance to be vaccinated. And obviously, we know that today might be the last day. From what we understand, this is the last day for that Sisonke study to get over, 500,000 of them to be vaccinated. And we're just hopeful that that process will be completed by today. But let's speak to one of the healthcare workers here. He has just joined us. Mike, talk to us. I can see that you are also coming through to actually get vaccinated.
Yes.
Talk to us. Were you here yesterday? And I understand that there are some people who were turned away.
Well, I believe there's a bit of chaos, but I also believe everyone's doing their best. I've parked a couple of kilometers away and walked. It was much easier. I think everyone's just doing their best. I think that's the best way to describe it. Obviously, the problem with Milpark, or not Milpark's problem, is there's a school across the road. So what you have is a combination of the school and the people coming to hospital. That's kind of where we are. But I think if everyone's just patient and understands everyone's doing their best, everyone will get this done. I believe they did about 3,200 people yesterday.
Yeah.
Excellent.
Excellent.
Yeah.
Indeed. And how are you hopeful that it's going to help many of the healthcare workers who are facing COVID-19 patients, so as to say, in this pandemic?
Well, I think it's going to help everyone, not just the healthcare workers. Eventually this will roll out to everyone. But for the healthcare workers, they're faced with this every single day. They come into contact, with patients. Certainly, I think it's a wonderful thing. I hope it rolls out as fast as possible. I hope everyone does what they can to make this work.
And I understand you're a healthcare worker as well, right? Can you just tell us what you do?
So I work for a dental implant company. So I'm occasionally patient-facing, mostly technical, but they opened it up this week to people that are not only patient-facing.
Yeah. And rumors that we might actually face a third wave. What do you think of that? I mean, amid this vaccination process that's underway, how do you think this is going to help a lot of South Africans? Should everyone get vaccinated? And I'm sure this is everyone's wish to get every South African vaccinated.
Well, I'm certainly not a virologist, so what I'm speaking is off the cuff. For some reason, we do seem tougher than the rest of the world, and if the third wave is coming, it seems to be coming much slower than we anticipated. And please God, with God's grace, it won't even come. Maybe we'll bypass it, or there'll just be a blip in the radar. But obviously, the more people that get vaccinated, the more people that had it, the less chance there is of it becoming a virulent third wave.
Yeah, absolutely. Mike, thanks so much for your time.
Thank you so much. Thanks, gentlemen.
Yeah, Leon, he's hopeful. He's hopeful that this is going to save a lot of people should they get vaccinated. But from what we saw in some of these people's cars here, frustration. Some of them saying that they actually took time off to actually get into this queue here today and to make sure that they get their chance to get that jab because today is the last day for the Sisonke study in order for them to get that number, the 500,000 healthcare workers that I understand that need to be vaccinated. But as I'm sure you might have seen yesterday, some chaotic scenes that took place in the parking lot of the Milpark Hospital, where some of the healthcare workers had to be turned back because apparently the hospital had ran out of the vaccines, and obviously they were actually told to write down their names and numbers so that when they come back today, it might not be as chaotic. But by the look of things, it is back to what we saw yesterday, frustrations, and we hope that this will be sorted out. We are expecting to actually go inside just after 8 a.m. to be able to speak to some of the managers there to understand the logistics that are actually taking place there.
Maageketla giving us an update there outside Milpark Hospital. That's a Netcare Milpark Hospital, just down the road here from the SABC. In fact, I'm sure there are cars in the area, but as you heard, also school starting there as well. But I don't think that takes away from the hundreds of cars and people that are desperate to still qualify for that Sisonke trial before it opens up to more people as of Monday. So we'll get another update from Maageketla in a short while.